The CDC estimates that there are 6 million women battling polycystic ovary syndrome in the United States. Add mental health disorders to the genetic, hormonal, and metabolic issues these women, including myself, face, and it becomes a huge economic burden.
I've lived with depression, diagnosed since I was 16 years old. And that's well managed and treated with a mild medication. But anxiety is one that is newer as an adult, especially after having children. I noticed that got more severe.
It didn't take Shelby Goodrich-Eckert long to realize her mental health issues, including an eating disorder, were directly related to her PCOS. It has taken time and thousands of dollars a month to treat them.
For therapy for my anxiety and depression, I get 6 visits a year. So I'm going 3 times a week, and each visit is $75. I mean, you can do the math. I used my 6 visits up in the first week of January, like second week of January. So, and the medications, a lot of them aren't covered.
Patients such as Shelby, who doubles as an advocate for herself and others, serve as a living testament to a recent study of the direct economic burden of mental health disorders associated with PCOS.
We know mental health is associated with PCOS. The majority of PCOS patients do have mental health disorders, such as depression, anxiety, eating disorders, and others.
PCOS Challenge founder and executive director Sasha Ati joined longtime researcher Dr. Ricardo Aziz for the study. For about 1 year, it put these mental health disorders under the microscope, using medical publications such as Medline that examined women with PCOS and those without it. The study showed just what they believed. Women with PCOS have a higher risk of depression, anxiety, and eating disorders.
The cost of mental health disorders in PCOS exceeds $4 billion yearly in the United States alone. And of course, PCOS is a global disease.
Now we've got this economic burden, more than $4 billion. What does that mean for you all? What's the impact here?
As the only patient organization that's doing legislative advocacy, advocating on behalf of the millions of PCOS patients in the U.S., this strengthens our advocacy, because over 60% of PCOS patients have depression, anxiety, and going to our legislators and showing them these numbers, the impact of PCOS is really important for us, appealing for PCOS to be treated as a public health priority.
The money aspect of it is sometimes what drives change.
Sasha, what about prevention?
I'll tell you what's the barrier to prevention, right? PCOS is underdiagnosed. Really, 50 to 70% of PCOS patients are undiagnosed. So they have no idea that they have PCOS.
The PCOS Challenge has a busy road ahead in the name of advocacy and ensuring PCOS becomes a public health priority. September kicks off PCOS Awareness Month, and on the 1st, it's World PCOS Day. The organization will turn more than 100 iconic landmarks around the globe to the color teal that day and throughout the month. Then the virtual PCOS Symposium takes place on Saturday, September 9th and Saturday, September 16th. Then in November, a patient-focused drug development meeting with several parties, including the FDA. You can go to our website, WJBF.com, and click on this story to get connected.